I'm Dr. Julian Zangrilli, orthopedic joint replacement surgeon at Seaview Orthopedics. I went to medical school at Rowan University School of Osteopathic Medicine in New Jersey. After medical school, I completed my 5-year orthopedic surgery residency at Jefferson Health System throughout various hospital systems in southern New Jersey and Delaware. During residency, I was exposed to all areas of orthopedics, including trauma, sports-related injuries, upper and lower extremity conditions, along with joint replacement surgery. After residency, I was fortunate enough to complete a 1-year fellowship in orthopedics, specifically focusing on hip and knee replacement. That was at Wake Forest University in North Carolina. And all along the way, I'm truly grateful for all the various mentors that have contributed to make me the best surgeon that I can be. My areas of specialty consist of focusing on patients who present with hip and knee pain and offering them various treatment options comprised of both non-operative and operative treatments. I enjoy performing both primary and revision total hip and knee replacements. Primary meaning patients who are coming in and having a joint replacement on their hip or knee for the first time, and revision joint replacement meaning a previously completed joint replacement that requires a second surgery. I also perform partial knee replacements for patients who fit criteria for that particular surgical option. For my hip replacement surgeries, I have been trained on all the various surgical approaches to the hip and mainly advocate for the use of the direct anterior approach for my patients. Conversely, for my knee replacements, I enjoy using the robotic technologies available to complete those surgical procedures. And aside from total joint replacements, I'm also trained to handle various other upper and lower extremity conditions with arthroscopy and other surgical techniques. So early on in my rotations during medical school, I realized that I wanted to pursue a career in a surgical field. I had been an athlete my whole life and always had a strong interest in learning about the musculoskeletal system, which initially encouraged me to try orthopedic surgery. So during medical school, I started shadowing mentors within the orthopedics department who were just amazing. And I appreciated being a part of their cases and particularly loved the opportunity that I had to learn how to treat different types of injuries, correct certain deformities, and ultimately relieve pain for patients. Orthopedics gives me the chance to restore a patient's mobility and quality of life, and it's a privilege for me to do so for my patients on a daily basis. I'm really excited to return back to New Jersey and join the team here at Seaview Orthopedics. The doctors and the staff here have done an outstanding job serving the community for years, and I'm eager to be able to contribute to that strong reputation that they've built over the course of my career. You know, I like to think of one of my strengths being interpersonal skills. So being able to interact with people on a daily basis, whether it's the staff in the OR or the staff in the office, and most importantly, the patients that I see on a daily basis and have a privilege to take care of, is definitely the most rewarding part of my job. Outside of work, I enjoy spending time with my family. I live in Monmouth County with my wife, my young son, and our 2 dogs. I also enjoy traveling and playing golf. Overall, I want my patients to know that I try to implement treatment plans for them that are as personalized as possible. I understand that the injuries or the conditions that bring patients into this office can be very overwhelming or debilitating, even though treating them can become very routine for us as surgeons. I want my patients to know that I will give them the time and the attention to detail that they deserve and work diligently with them as a team to be able to optimize their quality of life, relieve their pain, and restore their function.